Welcome to The Pulse. My name is Dr. Barry Chaikin, and I'm the clinical lead at Tableau. I'm joined today by Evan Crawford, Chief of Clinical Informatics at Fusion Consulting. Welcome, Evan.
Hi, Dr. Chaikin. Thanks for having me.
Evan, the past year has been rough for provider organizations and their patients. The pandemic has stretched provider resources and limited revenue opportunities. Patients have delayed care. As we emerge from the pandemic, how can organizations identify and prioritize patients to encourage their return to the healthcare system for needed care?
It's a great question. I think that organizations, in particular hospitals and health systems, need to leverage analytics to understand, what are the populations that tended to defer any procedural during this pandemic or during the last year, but also to understand, what are the marketing efforts that they're putting forth right now? How are they approaching patient populations? Which patient populations are becoming most profitable or generate the most revenue to the organization? And really, we need to have really concise marketing plans to outreach to these particular patients, to engage these patients, and to understand of those patient populations, what are the most critical for care, for outreach, who do we need to call first, and who do we need to ultimately target with our marketing efforts and our sales efforts.
I've heard the term outcomes analytics. Begin with the end in mind. What does that mean to you?
So outcome analytics to me means, the major drivers in a healthcare institution. So we look at things like length of stay, mortality rates, readmission rates, and ultimately cost of care that are provided to different acute or chronic conditions. And really, it's set up in a way to where you can perform analytics to understand what is our opportunity for improvement from both a cost standpoint and a clinical outcome standpoint, and then patient satisfaction as a result of that. So there's a lot of things that we can change internally to look at populations, understand where we have glaring weaknesses, or maybe things where we really succeed, and we double down on that particular patient population to bring in more revenue to the organization. So we see what's working and what's not working, and we're able to act on that information appropriately and to develop, treatment plans for particular patient populations, but also a marketing campaign, an effort to outreach particular patients, to educate those patients, and ultimately bring them back into our facilities and keep those patients that are already coming to our facilities.
I really like the term outcomes analytics because what it makes me think about is before you just develop analytics, think about what is the purpose of you developing those analytics, the dashboards, the visualizations, and how can those visualizations and dashboards inform decision making to drive towards the particular outcome that you're providing. The use of descriptive analytics is helpful. We can see where we are, but if they're not tied to a particular outcome, they're just kind of a nice to have. So the whole idea of focusing on those outcomes and making the analytics tied to those outcomes, I think, is incredibly valuable. So let me ask you this question. How does an organization use outcomes analytics to effectively target the right populations to achieve their objectives?
Absolutely. So what we typically do is, organizations can design it to where what we call, we use outcome measures, so things like length of stay, mortality rate, readmission, to create an opportunity matrix, to understand maybe what types of disease process, what types of particular patient populations maybe fit all four of those categories. So they have high cost, high length of stay, a high readmission rate, or maybe even possibly a high mortality rate. And then ultimately you have to throw in what are the most profitable patients. So typically those are surgical cases that we can bring that patient in, provide a treatment path that allows the organization to incur the most revenue that they possibly can, and then we can identify, what are those populations or those characteristics of patients that tend to bring us the most revenue. So whether that's a particular disease state, a surgical case, or even what treatment paths or what patients work well with different payer models, and how we can understand those patient populations, really identify and hone in on the highest priority for the organization to create, targeted campaigns toward these particular consumers, for lack of a better term.
If we think back about the history of analytics, we know that there were a lot of operational tools that had analytics built in, and you were able to kind of see what's happening with that operational transactional system. But now analytics have advanced to be rather sophisticated, where they can take data from multiple data sources and put it into a dashboard and visualization. And those data sources include the EHR, the CRM, ERP systems that might be deployed within an organization. What data can be derived from these systems to better identify patients for the interventions you just talked about?
Absolutely. So, the EHR is gonna be a lion's share of the information that you get on clinical outcomes for these particular patients. But and it also helps you identify, patients who haven't had an appointment for a long time, an office visit, patients who need a repair for a surgical procedure but haven't done so effectively yet. So those might be existing patients for surgical specialties, but they haven't yet scheduled that operation or procedure. So we need to identify those particular patients. And then when it comes to things like marketing automation tools, CRM, it's really where you get all the patient-generated data that's done outside these hospital walls. The stuff that I really think affects or influences consumer behavior or patient behavior on whether or not they feel comfortable with your services, whether or not they want to come into your services. It's also a great place to understand, patient satisfaction scores, data that we can't get as either clinicians or providers or physicians in any capacity, but we can get those through community outreach to understand, how people think in our particular geolocation, and how we can effectively market to that population, whether that's through, digital marketing, which is becoming more and more apparent that you have to have some sort of digital marketing plan for hospitals and healthcare systems, or even small provider groups, but also things that are done traditionally like direct mailing and that sort of thing. But we need to be able to identify those patients, and we can bring information to really hone in on the kind of psychographic content of these particular patient populations, how they like to consume data, and how to best get their attention when we offer new services or provide new opportunities to bring them into our walls.
If we go back 10 years, when the HITECH Act was a little more than 10 years, when the HITECH Act was passed, these last 10 years has really been all focused on the EHR. And you just said that there are other sources beyond the EHR that can be helpful. Can you elaborate a little bit more about how those data sources can work together to create a bit of a broader picture, and that maybe we've left the era of the EHR and entering an era of analytics?
Well, so I don't think we've entirely left it, but it helps us make informed decisions about how we can engage patients better. So ultimately, when you're talking about prioritization, that kind of analytic, or that at least the data elements that come to provide those types of analytics, comes from the EHR, so that we can understand complex clinical data, we can understand operational data, we can understand financial data from the EHR, because a lot of times this financial information is stored there as well. They've made leaps and bounds in EHRs over the years. They have a lot of comprehensive analytics embedded in there. But it's also good to get all that information to be able to communicate to the patients. And I think that layer of patient engagement is becoming more apparent that it's utilizing a tool like CRM or a marketing automation tool, where you're really understanding, developing marketing content, developing web pages, developing specific dynamic emailing to this patient population to maybe define new services, to outreach, to engage that patient, to bring them back to your website, or to bring them back to an educational piece, or to provide video content for a particular chronic or acute condition that a patient might have or is researching. So we always want to keep that in mind. But there are so many new sources, and as we continue to evolve, and really COVID accelerated this conversation to where we're talking about things like, even in the future, AI and machine learning, voice technology, how we can make this frictionless for a patient or a consumer to understand what a hospital or healthcare provides, and ultimately how they can get either scheduled for a procedure or office visit to bring in to provide services for them.
Severity adjustment is an important factor in assessing a patient population. Can you share with us some of the indicators used in severity scoring and how the scoring is implemented?
Yeah, I think it's if you look at things like disease state, so often with our clients that talk about chronic condition management, we prioritize those patients based on severity. So what is the progression of their disease? What state are they in? If they need a repair, how well is it functioning for that particular body part, organ, what have you? Really, if you're looking at a population like congestive heart failure, we want to understand, how well their heart function is at a certain time. When's the last time they've seen a cardiologist? When's the last time they've been to a hospital? All those things play into account, and we make specific algorithms for different institutions. So, oftentimes you can use standard scoring for severity of illness, but we also want to take into account each organization's prioritization of that patient population. So I work a lot with surgeons, work a lot with different providers that have specializations in like cardiology, neurology, that look at specific disease states, understand those disease states, and understand and prioritize who we should outreach to first. What are the patients that really, really have been neglecting care that we need to outreach to? We need to get them at least to have a conversation with them and try to get that conversation going to where we can provide services and we can only provide better outcomes for them.
What digital tools are available to grow patient acquisition, and how should they be utilized for patient engagement, marketing, and enhancing the patient experience?
Yeah. And I think we touched on this just a little bit ago, but it is really crucial to, I think, embed and integrate CRM in any capacity, whether that's any product. There's a multitude of products out there. Also, is the fact that we always have analytics. It starts with analytics, and then it drives that conversation to using tools like the CRM as well as different marketing automation tools, so that we can set up individualized, customized patient journeys. So once we get someone aware of who we are, what we do, and the services we provide, all the way to when they're deciding whether or not to utilize this hospital or health system as their point of care. These kind of tools can do anything from creating, SEO, you're generating a better SEO, to looking at different optimizations of your website to drive traffic to your website, to create opt-ins so we can get general information from individuals so we can perform outreach to them. Often we'll send flyers or information around our products or services that we have at a hospital. And then ultimately, if the consumer opts in, they're able to see kind of more information, but also to provide educational content. I don't know the certain percentage, but a multitude of what people consume is going to be video content. It's educational content. I know personally, if I have an illness and I have a medical background, so I will do that research ahead of time, see what kind of content is out there, see what kind of organizations are at peak levels of performing for these particular processes, procedures, clinical conditions, so that I know as a consumer where my best odds of having a great or optimal outcome are.
Metrics are very much important in looking at return on investment, tracking projects, things like that. So what metrics should be used to monitor the effectiveness of any digital patient acquisition project?
Yeah, I think it's really to look at your marketing channels, your digital marketing channels, or non-digital channels within your marketing campaigns, to understand, what is the cost acquisition of these particular patients. So what is your marketing spend versus the number of what we consider a patient as a lead, all the way to when they actually become a patient in our facility. It's really to understand that and to analyze that. You just look at the particular campaigns that you set up. So if you start a campaign, let's say, to target congestive heart failure patients, as an example we talked about earlier, we can outreach those particular patients through different modalities, whether that's website, email, call campaigns, as well as things like Facebook. And then we understand for each of those channels, what is the outreach or performance. So if we spend X amount of dollars, how many patients are actually acquiring through these different modalities or these different channels within the marketing spectrum, so that we can greater determine, what is our ROI on spending this amount of money? What other channels do we need to go after? What are the different, geographical locations or restrictions that make, the perfect patient characteristic for high profitability? And we need to identify those early to create, complex and centered or precise marketing campaigns around these patient populations, as well as to a broad geolocation, so that we can understand, where our marketing dollars are going and how many of those marketing dollars are being effectively well spent and bringing patients into our walls.
People really enjoy learning from the examples of successes achieved by others. Do you have any examples you can share with us that highlight these successful initiatives you've spoken about?
Absolutely. We've worked with several clients. One that comes to mind is there is a pediatric cardiothoracic practice that really, looked around the market and said, we are losing these patients. These pediatric patients are being born in our facility, being diagnosed with a congestive heart defect, a congenital heart defect. And as a consequence of that, they're not coming back to our facility for any type of care. So they don't come to a pediatric cardiologist for a follow-up. They don't have any surgical procedures or repairs for their condition. And we're losing out to other facilities in our local area. And how can we identify all those patients that were born in our facility? Where can we at least get a conversation going with their parents or with them if they're of age? So really, this was done through analytics. We create a really complex, algorithm for defining, what is the patient's fundamental diagnosis, what is their sub-diagnosis for congenital heart defect, and then ultimately, what is their severity? When's the last time they've been repaired? Do they have any repair status? When's the last time they've been to our facility? How old are they? Are they still alive? And then we want to know, are they in our system? Are they in our AHR still? So can we perform outreach? And then they made a really concentrated effort. So we found about 5,000 patients that they could outreach to, start performing marketing to. So the Heart Institute really pushed the marketing efforts to these particular locations. Now that we knew zip codes and those sort of things to help identify these particular patients to perform outreach. But it's also a concentrated effort from the clinician himself, who hired a group of nurse practitioners to perform outreach to these particular patients, to check in on them. He didn't care if they told him that they didn't want to come back to the facility at all or anything like that. But it presented a significant amount of revenue opportunity just because of the high volume cost of procedure or the revenue they would generate from a particular procedure, but also was what was best for the patient. We've also had different organizations, and one that comes to mind is a behavioral health or mental health facility for adolescents that looked at the entire patient journey and said, okay, we're going to use analytics to define our most profitable patients. And that from start to finish, who is our most profitable patients? What kind of disease did they prevent with, or what kind of mental illness did they prevent with? And how can I take them to the continuum? And what kind of clinical care pathways do work best with different payer models? But also, what are most cost effective and what are most revenue generating? So we looked at different care pathways, and we said, okay, if patient X has this illness, and they go through the continuum, and they start with an office visit all the way to when they're not a patient anymore, or that condition is resolved, or ongoing for the rest of their life, depending on the condition. But really, it's an opportunity to look at that, to hone in on how well you're doing operationally, how well you're doing with your prioritized patients or your most profitable patient line, and to really hone in on your care path and to change it if needed, to identify how you can become better and how you can create, specific marketing campaigns towards this patient population to get them in the doors, in particular to get your most profitable patient characteristics for lack of a better word, to bring those into your facility and to get more dollars in your facility, but also to do the right thing by the patient.
I want to look retrospectively for a minute. You know, we've all been through COVID in the past year plus, and it's changed everything on how we live our lives. But for our profession, you and I, it's really about healthcare and the people that we interact with. So, can you give me an idea about what you see as what COVID and the pandemic did to change healthcare?
The biggest trend I see is that people have a choice now. I have a choice. You have a choice. And a lot of big players that were traditionally in the tech space or in retail, they're starting to become disruptors in the healthcare space. So there's non-traditional, non-hospital kind of organizations like the Amazons, the Googles of the world that are looking to get in healthcare. And they're going to make it frictionless for people to acquire, any sort of healthcare services. And I think that hospitals and healthcare systems have to kind of buck the traditional notion of their marketing efforts, and that if you're just born in a geographical location, you're definitely going to go to this facility because it's the closest one to you. I think in the future that's going to change because a lot of things have become digital. They're easy. So when you look at mobile capabilities, you look at telehealth capabilities, and the thing that I see the most in the future is things like voice technology. I don't think, if you don't have a plan for voice, and I mean like, things like Alexa or Google Home or Siri, when I ask a healthcare question, I better be the first organization that comes up with an answer if I'm in that location. I think that is going to be the next mode. Or if I need to fill a prescription, I say, hey, Siri, refill my metformin prescription. And it's automatically going to do it. And then maybe that comes to me. I just want to, when I think about the future, it's all about what is easy for the consumer, what is easy for the patient, but also gets their care done more quickly. And then I also see a lot of predictive modeling with that, like how we can design or go after and better predict, when a patient comes into our facility or where it's a new patient, what is the total life of revenue for this particular patient? What do we think it's going to be based on their disease, based on their socioeconomic, whatever it might be? There are going to be things with AI and ML that progress towards that kind of predictive modeling in that space.
So I got a scenario I'm going to ask you a question about. Let's make believe that you're in a major city in the United States. You got invited to a private dinner with the CEO of a relatively large health system in that major city, right? With all that you've said about the pandemic and all the changes that you've talked about in healthcare, you have this whole dinner to talk to that person. What would you tell them? What do they need to do to be successful in the next 10 and 20 years?
I think you have to start with the basics. You have to crawl before you walk. And I think that it all starts with an enterprise architecture for analytics. It's to have the backbone to make all these informed decisions and to do it in a litany of ways. So we talk about all this different data that comes in healthcare now. Well, it's even going to get worse because you have healthcare data that's coming from mobile applications, cloud applications. Everything will eventually move to a cloud application. So how do you use that network throughout the world to create and consume and generate meaningful analytics from all this data that's coming in? And then ultimately, how can you use those vessels like a CRM or a marketing automation tool to perform outreach, to do the actions that you want to do to drive back to the outcomes? So what are the things that I need to do first? And then how can I drive better outcomes through engaging or utilizing these new tools? And I think you've got to have a plan for, number one, analytics. You have to have a plan for marketing and digital marketing and a strategy around that. And ultimately, you have to look towards the future, not what has happened, but what will happen. And we know these things are only going to get more and more invasive in our lives as far as, back in the early 2000s, I had a cell phone. It was a flip phone. Now everything is done from my phone. It's AI at its finest. It's an automatic. It's a detachment. It makes me more efficient. It makes everyone more efficient. And those kind of things it's not going away. It's going to get more invasive in our lives to where it'll be in our home, and that we can generate and demand healthcare services from the comfort of our home. And you have to be able to utilize that and convey that, and give your physicians, your providers, and your hospital the ability to utilize these technologies that are up and coming so that they can perform what they do. Like you just touched on it. I care about patient safety. I care about patient care because I'm a nurse. You care because you're a physician. We care about different things, but ultimately we know that we have to use these technologies to do it effectively. And it's not going away. It's only going to get worse.
Your comments reminded me of Wayne Gretzky's famous quote, "I don't skate where the puck is, I skate where the puck's going to be," which of course made him a Hall of Fame hockey player. So I have one more question, and I want to ask you about trends, because we talked a little bit about what the future would be like, but I want to ask you about trends. So what trends do you see emerging in the marketplace that will impact how we keep and grow our patient populations?
Yeah, so one of the trends that I definitely see is the idea behind consumer analytics or psychographic analytics, because people consume information in different ways, and there's a lot of different definitions on who skims through a web page, who really consumes and sits down and read data. But often what you'll see, in marketing, a lot of people that are smarter than I am have done a lot of research around consumer analytics, consumer behaviors, in particular psychographics, and how they consume healthcare data. So how they pick their providers, how they pick their hospitals, how they pick the services that they want. Most of the time it's consumption through video and other methodologies, but it also helps an organization understand kind of the characteristics of different models of consumption. So the easiest way to do that is to send out questionnaires about how people consume healthcare data. So you could go to a particular location. Let's say that you're in a major metropolitan area. Send out survey information through just a generic email blast to different areas, or to even have the ability from your website to do these questionnaires so that you can generate and you can get that data into your CRM so that you can understand how people think, how they consume data, how they want to consume healthcare data, what they want from you as an organization. So those kind of things are crucial, and I think that right now that's the trend that people are trying to understand, trying to get their arms around it, trying to use analytics to do so, to really make the best decisions on where to spend their money to get the most ROI out of it.
Thank you very much for that. I'm thinking that you talked about these large digital companies, right, that may be entering healthcare. The reality is they know more about me, and the Amazons, the Googles, the Facebooks know more about me than I know about me. The government knows about me. Anybody knows about me. And clearly, we need to start thinking about using some of the data, similar data that they collect, in how we manage our provider organizations, our healthcare organizations, how we treat our patients. Evan, thank you so much for your time today. I very much appreciate it.
Thank you very much. I had a great time.